Hi, this is Congressman Frank Pallone. Thank you for joining me on Facebook Live. We try to do this every Friday around noon or so. Today was a momentous day, and it's been a momentous week. We just passed this morning the Build Back Better Act, which is the third prong, if you will, of an effort by House Democrats to basically deal initially with the coronavirus and its aftermath, and then build the country back better with better jobs and better health care, and trying to address the climate crisis. So the Build Back Better Act, which was voted on in the House and passed this morning, now goes to the Senate, is the legislation that primarily focuses on health care and climate needs of the three bills for the future. And so with regard to climate action, some of you know that I spoke last week about how I had gone to the conference in Glasgow to implement a climate action plan. And this bill that we voted on today does more than anything else that's been done in the Congress to address climate action concerns. So just as an example, there's a methane emissions program in the bill. And when we were at the climate conference in Glasgow, there was an international agreement to move forward on reducing methane emissions, which is a major source of greenhouse gas emissions and therefore the warming of the planet. And in this bill, we have a program to catch the emissions that you see sometimes. If you're on the turnpike, for example, you'll see the oil refineries that have the flare, the flame, if you will. And this seeks to capture those emissions and reuse them, and so ultimately save money, both for the industry as well as for the utilities or the consumers who use the gas. But in addition to that, there are major climate provisions in this legislation trying to get utilities from stop using fossil fuels, providing homeowners with rebates if they move towards renewable resources. There's also a provision that would prohibit drilling off the shore of the Atlantic. You know how important it is to our coast that our coast remain free of pollution and oil spills. And then on the health side, the bill makes some significant changes that came out of my committee, the Energy and Commerce Committee. For one, we make sure that a higher level of subsidies to help people pay for their insurance that they buy on the marketplace is extended for a longer period of time. We also have expand Medicare to include a hearing benefit for seniors, which is not available right now. We make the Children's Health Insurance Program permanent. We address maternal health. We have, as unfortunately, one of the highest maternal health mortality rates in the developed world. And there are just a number of provisions, most important, that try to make healthcare more affordable. And probably the most important in that regard, which again I was very much involved with, is trying to bring drug prices down and have the federal government negotiate drug prices and make sure that seniors don't pay more than $2,000 a year out-of-pocket costs for their prescription drugs. So a lot in this bill. It now goes to the Senate. We worked a lot of these provisions out with the Senate, so we expect that they will hopefully very quickly in the next few weeks send it back to the House, and then it goes to the President. Now the second prong of this, I call it the Build Back Better agenda, the bipartisan infrastructure bill. I was at the White House. That passed last week, and I talked about it. But this Monday, I was at the White House where the President signed that bill. And again, I won't repeat, but that's the bill that really invests in our infrastructure, things like the Gateway Tunnel, more funding for mass transit in general, but also infrastructure to upgrade the electricity grid so it accepts renewable resources, reinvigorating the Superfund program by taxing the chemical industry to pay for Superfund toxic waste cleanups, and the list goes on. So we really have accomplished a lot in the last 2 weeks. So I think between these two bills, the infrastructure bill and this Build Back Better Act, we've probably done more to make a difference and help Americans and create jobs and make things more affordable than any other legislation in the last 10 or 20 years. In any case, I also wanted to mention that my committee, the Energy and Commerce Committee, continues to forge ahead with other legislation. As you know, we deal with public health issues in general, so our committee advanced 12 public health bills to improve the public health this week. These are things, some of which are disease specific. So for ALS, or Lou Gehrig's disease, as it's often called, we passed legislation that makes it easier to access clinical trials and get drugs that might make a difference and prolong these people's lives that have ALS. We also held a hearing on securing the clean energy supply chain. You're probably all so tired of hearing of supply chain shortages in various sectors, but we're trying to deal with that, and this one deals with the supply chain for clean energy. So there's a lot going on that will continue to go on. But I did want to make a few announcements. I think some of these I've mentioned before or tweeted out, or they're on Facebook, but let me remind you that New Jersey's open enrollment for health insurance, for healthcare insurance, is open. And if you want to buy health insurance or you want to change your policy, you can go to getcovered.nj.gov for more information. That's getcovered.nj.gov for more information on buying health insurance in the Affordable Care Act marketplace. And as I mentioned, and part of this legislation was to increase the level of subsidies to help people pay for their premiums. Also, Monmouth County residents who need rental assistance due to the COVID-19 pandemic can apply for the Emergency Rental Assistance Program. The American Rescue Plan, which is the first bill we did this year to deal with the COVID crisis, provided the program with funds to help income-eligible households pay rent. And so you can find out more about that by visiting www.monmouthcountyerap.com. That's monmouthcountyerap.com. And then, of course, I always like to talk about vaccinations because we encourage you to get vaccinated. Children between the ages of 5 and 11 are now eligible for a COVID-19 vaccine. To find a vaccination site, visit covid19.nj.gov-finder. Be sure to look for pediatric doses when you search for a location. You can also call the COVID-19 Vaccine Call Center at 855-568-0545. The COVID-19 vaccine booster doses are now available in New Jersey for the J&J, that's the Johnson & Johnson, Moderna, and Pfizer COVID-19 vaccines. And all adults who received a single dose of the Johnson & Johnson COVID-19 vaccine are eligible for a booster at least 2 months after their shot. For individuals who received a 2-dose Pfizer or Moderna COVID-19 vaccine, the following groups are eligible for a booster shot at least 6 months or more after their second shot, and that's 65 or older, long-term care residents, adults with underlying medical conditions, adults who work or live in a high-risk setting. And let me just conclude by thanking everyone for joining me today. Have a good weekend and a happy Thanksgiving.